I'm Dr. Blaney. I've been practicing medicine since 1975 with a holistic orientation since that time. I was exposed to cannabis while in medical school, both in terms of being a student, because in the 60s, early 70s, it was a pretty common recreational activity on university students. But I also had the opportunity of spending time studying the effects of cannabis on performance at the University of Ottawa Pharmacology Department. And initially basically observed that the use of cannabis, by and large, by most people that I had as patients and or as friends, was a pretty innocuous herb. Later on, as I progressed into dealing with more chronic pain and chronic illness patients, the aspects of cannabis of importance. It came back into my practice because of the fact that it had anecdotally quite good effects with people with chronic pain with very minimal adverse effects or side effects. During this time, the biggest problem with the access and utilization of cannabis was obviously the legal status of cannabis at the time, which impacted on the availability and quality of the product. Despite that, I never witnessed any significant acute or chronic adverse effects in my patient group. It has been associated that use in adolescents could affect performance and motivation, could have some other negative effects, but as I said, in my own personal experience, I never witnessed that as a major problem. I was first introduced to cannabis professionally when I was in third year medical school. At that time, we had the opportunity of doing an elective, and me and my peers did an elective on the non-medical use of drugs, of which one part of it was analyzing the effect of cannabis on performance. In laboratory settings, we had a device that mimicked ability of driving capacity, and using medicinal or using cannabis that was produced at that time by Agriculture Canada, we assessed the effect of cannabis in different amounts on performance, driving performance, and found no deleterious effect. We then added alcohol and found that there was a marked deleterious effect in terms of performance. Medicinal cannabis has had a fairly profound benefit on a number of my patients who, because of their condition and because of their tolerance, or more correctly, intolerance to the available medications, have found it to be either a sole remedy that is of much benefit or as an adjunct to remedies they're already taking, and therefore lessening the amount of use of opiates or tranquilizers or muscle relaxants, etc. The benefit of cannabis is that it is something that can be delivered in variable doses, and so each individual can find the most practical and most effective dose for them to use it, so that they will vary the dose according to what their condition is and also for what their activity levels are. At this moment in time, there is no legal prohibition for a licensed registered medical practitioner to prescribe cannabis to be used medicinally in patients who have conditions that warrant. At the same time, medical practice is governed by various colleges or medical boards, and depending on the various provinces, the attitude of the medical boards varies. In my practice, I have a number of patients who have been using medicinal cannabis with great benefit. I have quadriplegics who are troubled by intense muscle spasms, which they find that by utilizing cannabis in adjusted doses can minimize or lessen the intensity of those spasms. I have patients who have inflammatory arthritis who find that by using medicinal cannabis that they utilize other pain medications less or not even at all. A number of my elderly patients have asked me about it, particularly to assist them in terms of sleep, because they have great sleep difficulties and the available sleeping medications are fraught with problems in terms of true addiction and side effects and adverse effects. The things that it's when the patient can access a clean, safe source of cannabis and have the tools available to utilize it safely, they have very good results with it, because one of the most important things about cannabis is that cannabis dose can be adjusted or titrated, as we say. So patients will find that they can utilize cannabis in small amounts throughout the day with minimal impeding of their actual ability to function, and that they might use in the form of a vaporizer or in the form of inhalant forms. And then in the evening or nighttime, when they want to have the more sedative effect or encourage better sleep or give a more profound pain reduction, then they can either increase the dose that they're taking from an inhalant point of view, or can go into a form like an edible form where they will have a more prolonged effect of the medication in their system. So, you never worry about an overdose. With other more potentially dangerous drugs such as opiates, benzodiazepines or tranquilizers, sleeping pills, which are being noted to be causing greater and greater numbers of overdoses out there. There's a big problem with leakage of these products getting out into onto the street. So if someone can benefit from the use of medicinal cannabis, as a practitioner, you sleep easier, because you're not going to worry about getting the phone call from the ER saying your patient's in here because they overdosed, or that you faced your patient who is now taking 2 or 3 sleeping pills at night, and the pharmacy and the colleges are all saying you can't take that much, and they're desperate because they have no way of sleeping without utilizing them. So being able to switch them to something like cannabis where you don't have those issues could be really a boom to a lot of practitioners out there who are dealing with these patients in their offices. What I think the cannabis issue has taught me is how previous non-scientific attitudes and prejudices has prevented a very potentially positive medication and safe medication from being utilized. Prior to the prohibition of cannabis, cannabis had historically been used over millenniums in a number of conditions quite successfully, and in fact in the early part of the 1900s it was utilized quite widely. With the prohibition, all of that research was basically stopped, and so a potential product, which if you think back of it, if cannabis had been allowed to be researched and processed and utilized over the last 80 years, how much further ahead we might be at this point in time in terms of treatment of chronic pain and a number of other conditions. It also taught me that one has to keep an open mind when it comes to the utilization of products that anecdotally have been shown to be of benefit, even though we may not know scientifically what it is that they're actually doing. If they're safe, if they're effective, we may not necessarily need to know what they do in detail to use them. At present in Canada, we are going from a pre-existing regulatory process called the MMAR, where a patient, after going through an evaluation by their medical practitioner, was allowed to acquire cannabis for medicinal purposes after receiving their license from Health Canada. Being in Canada, we obviously are going to be strongly influenced by what is happening in the United States. At this moment in time, the United States politics is quite unique because you have the federal politics and you have the state politics. On the state level, there is an increasing number of states that have loosened the constraints on the use of cannabis to the point of allowing it for medical purposes, reducing the penalties into misdemeanors, and in certain states have actually legalized the recreational use of cannabis. On the other hand, the federal law is still prohibiting the use, possession, selling of cannabis throughout the United States. The federal regulation, unfortunately, has a big constraint on research and scientific investigation of cannabis, On the state side is because it's piecemeal. There are states that are having cannabis that's easily accessible and right beside states that don't have it accessible, and so it's creating a fair amount of problems. But I think what it's showing is that the popular will is starting to become more and more accepted by the political will, because pretty well every survey that I've seen over the years has shown that the vast majority of Americans prefer that cannabis be taken out of the criminal code, that people be allowed to access it for use medicinally, and maybe not a majority, but certainly a significant proportion of the population feel that it should be allowed to be used recreationally with a certain amount of control. So using cannabis medicinally in practice, in my experience, one can be pretty assured that it'll have pretty good effects on pain issues, on pain associated with inflammation, spinal cord injuries, neurological degenerative disorders such as MS. There's evidence to say that it's helpful in ALS. Evidence to suggest it's helpful in terms of reducing agitation in dementia and Alzheimer's patients. Pretty likely to show benefit, and if in the more elderly or mentally impaired patient, as long as their medications are supervised, there's really no problem with it. Using cannabis in a pediatric or in children is problematic because we really don't know what stimulation or activation of cannabinoid receptors by cannabis does. There is certainly some suggestion that using of cannabis by adolescents could increase the potential of them developing some form of more significant mental disorder. So in the pediatric group, I think one would be cautious to use it except in cases where the benefits would greatly outweigh the negatives, and that's really in some of these pediatric seizure disorders where there has been anecdotal and some case studies that have shown that the use of cannabis in some of these very intractable seizure disorders in children can be life-saving. One of the intriguing aspects of cannabis is that there are a number of strains available, and there are great possibilities of developing new strains to increase or decrease contents of THC and CBD, which are the two cannabinoids that are most interest at this point in time. So the basic, all cannabis strains will all have a very similar effect, globally speaking, but they could have quite different effects in terms of how they impact on the various receptors. So CBD has beneficial effects, but with very few psychogenic effects, versus THC has a number of beneficial effects, but obviously has more psychogenic effect. So there's the potential somewhere down the road that these things can be adjusted by varying of strains so that one could basically find a strain that would be most appropriate for the patient, their needs. But you know, the plant is going to give you very similar impacts, just depending on, but some mild variations in terms of how it impacts you in terms of symptoms. Like all herbal products, there's a certain level of uncertainty, so we don't know all of the things that it does, but as I say, historically, cannabis seems to have been utilized for a long period of time without any significant long-term adverse effects. Now, as we expand that population, if cannabis starts being used medicinally in a large segment of the society, and in patients who have a wide variety of illnesses, we may find that there is some unexpected, unintended consequences, but I think that those things probably more likely than not would be very mild or modest. We know that in terms of pain management, in terms of sleep management, most doctors are frustrated because we have limited resources. Resources often have fairly significant adverse effects. There's a fair amount of regulatory oversight and control. And so I think most practicing practitioners, if they were able to utilize cannabis in a medicinal way, I think it would help them in their practice to quite a good extent. What I would like to see is, number one, it be decriminalized. Two, that it be regulated in probably a similar way as tobacco and alcohol. And in the same frame as alcohol, probably will end up with people being able to grow personal amounts of cannabis for their own use, just like people can make beer or wine at home. What I see in the future with cannabis is going to be somewhat based on what happens in terms of legislation. Right now, it's very difficult to do any sort of research or studies utilizing cannabis because cannabis is still deemed a Schedule I drug, which means it's put in the same category as heroin, LSD, mescaline, psilocybin, meaning that it's a dangerous drug with no potential benefit. Therefore, it's very difficult to get ethics boards to okay clinical studies on the use of cannabis in certain conditions. Doctors at this moment in time are hesitant to prescribe cannabis because there isn't any sort of research that backs its support, yet at the same time, legislation prevents good research from being done. So at present, most of the research is coming from synthetic products that are used to either stimulate or inhibit the receptors, the CB1 and CB2 receptors, and then there's speculation from those results on animal models most of the time as to how they may or may not benefit in the human population. So I think what's going to happen over the next number of years in terms of medicinal cannabis use, one will be based on a freeing up of the regulatory process to allow for better clinical studies using patients and seeing who have certain conditions and seeing its effectiveness in comparison to other medications. I don't think you can do human patient studies in terms of a double-blind placebo crossover format because the research is pretty well supported that it is the whole plant product that seems to have the most medicinal benefit versus the synthesized TH1 or CBD products that have been made, which have not shown to be that effective compared to the whole plant product. We now know that there is what's called an endocannabinoid system, which means that we have in our body receptors that respond to cannabinoid-like substances which our body actually produces. And that cannabis has exogenous or cannabinoid substances that can activate a number of receptors. The most common receptors we're interested in so-called CB1 and CB2 receptors. We know that by regulating those receptors, there can be a profound impact on the immune system, on the cardiovascular system, on the hormonal system. And what we'll probably find is that there's going to be a number of conditions where these receptors are not responding properly, and therefore the taking of cannabinoids from external sources, such as medicinal cannabis, could be of great benefit to those patients. I suspect with further research, we'll also identify certain conditions where these receptors are hyperreactive and would therefore there would be a negative effect by the use of cannabinoid substances. And that may explain some of the situations anecdotally where people will talk about an aggravation of symptomatology arising from the use of cannabinoids. That research right now, as I say, is limited to animal studies using synthetic versions of cannabis, but even with those limits, it is definitely indicating that there could be some very good potential uses of cannabis in the future. And I forgot to say, but it's one that's probably even really important, is that there is evidence to say that it has some effect on cancers and other malignancies. One has to say there is a potential that you will have symptoms and feelings that you may not be comfortable with. You know, they could be quite mild or quite moderate, but they're transitory. And if on utilizing medicinal cannabis that symptomatology is uncomfortable, then one can discontinue the use of cannabis without any medium-term or long-term consequences. At the same time, if you instruct them and say these reactions diminish with use and diminish once one has a better idea of what doses you can tolerate, they really become quite a non-issue in the utilization of cannabis medicinally. And the nice thing about cannabis is that if it is beneficial to the person, the effect is relatively quick. It's not like antidepressants where you have to be on them for a number of weeks before you may feel a benefit. So if cannabis is going to help your pain, if cannabis is going to help your muscle spasm, if cannabis is going to help you sleep better, if cannabis is going to help you be less anxious or have a better appetite, you're going to know it fairly soon on the process. And if it is beneficial, you'll soon be able to find out what dose and what frequency and in what form is best for you.